further, you need more room between the pubic bone and the tip of the coccyx. And so you switch and you put pressure on the top of the sacrum to open up the opposite direction. Does that make sense? So basically you're using the sacrum and the tailbone as a teeter-totter to make room either at the top or the bottom. And so this is what I tell you guys, you get real familiar with each other real fast. Basically what you're going to be doing is find each other before. Yeah, but the thing is most of the time you don't have your hands sitting right in their butt with the labor and all that kind of stuff too. It's a good point. Hi there, nice to meet you.
It's cool. I'm a massage therapist. I do cranial sacral, so I'm used to people messing with my sacral.
So basically what you're doing is, it's a long fine. It's like, I do this all day, it doesn't bug me. Everyone else is like, just shut up and just get in there. But basically the sacrum is a triangle bone. It's in between the two hips. Spine sits on the thing. As you get to the very tip of it, it's the coccyx. It's sensitive, okay? So you don't want to be right at the tip of it. But basically the sacrum is about the size of your hand. It's approximate. So it's sitting here. What you have to do is be able to find the very tip of the coccyx here, okay? So once you get that dialed in, so you know you're at the very tip of the coccyx here, you come up about, the distance of about the palm. And from there, I'm usually using the edge of the hand because it narrows down. And just pushing this direction, okay? You're pushing straight in. Realistically, from my angle, I'm trying to stay out of the way, but you really should be going straight in this direction so that the sacrum is doing this. So you don't want to be pushing it at an angle to cause the sacrum to try to torque or that type of thing. You really want to just go straight back to front. So you can get the hand in there. A lot of times will do this. I will just stick my elbow against my, especially if they're laying there, against the leg, and use the weight of the leg to push in. Right now that probably feels pretty comfortable to you. Yeah. No problem. And you just hold on to it, okay? These guys will let you know what you need to do. If you're pushing too hard, they'll smack and just don't take it personal and back off. There's times where it feels good just to be laid into it, and you feel like you're just going to push them into the next county, and you just, whatever you guys need, tell these guys, okay? Whatever feels good. And at some point, you're going to be pushing on that, and all of a sudden you're going to go, stop! And you let off. At that point, what the baby has done is got far enough down into the pelvic canal that you're now constricting that, and the baby they hurt. So at that point, you switch to the top of the sacrum. So again, the sacrum's about the size of your hand. Tip of it's right here, top of it's up here. Same thing, you just switch to the top of it and push in straight in like that. Uncomfortable to you all? I was going to say, you're not big enough. If we got you on the table, as you get further along with this, even right now, if you push on the top of it, you're going to get some compression. The baby a lot of times will find it uncomfortable.
And what does this do again? Why do you do this?
This is to basically make room as the baby is coming into the birth canal, as you're laboring. As you're pushing on the bottom of the sacrum down here, you're opening it up and allowing the baby to come into the upper section of it. As the baby progresses further down, it needs room at the bottom, so you switch and you push at the top to give room so the baby's head is coming down. Bottom line, it just is really comfortable. It really is. It gives you guys something to do to help these guys, and you just find it really comfortable.
Do you hold on to the hip with the other hand, like to anchor it in place?
You can do whatever you want. You can sit and rub them on the back, and it's whatever. You just, as long as you've got this. But I tell you, get yourself set in for the long haul. Make sure that you have yourself comfortably in your own physiology. Because if you get up and you're doing something goofy like this and you can't hold on to it, after a while your back's going to be sore, whatever. You got to get yourself into a mechanic. Even if you were the other hand, if you had to switch the other hand, same thing. Get the mechanics. I'm here. I could sit here forever because I've got my body set in a place that's comfortable for me. My knee may be sore, but get a pillow off the bed or whatever, and stick it underneath your knee, whatever you've got to do. But just make sure that you mechanically take care of yourself as well. You don't want to hurt yourself in the process of helping. But those are the basic points with it. Like I said, the leg over on these guys. Oh, let me have you stand up for me. You can basically do the same thing. And stand later and then turn it face me. Basically doing the exact same thing standing. I'm going to have you put your arms over my shoulders. Tuck in. Nice to meet you. Same thing basically with this one. if you just reach down, you can end up coming down so you feel the tip of the sacrum. You come up just a little bit from that, and it's just finger over finger, and you just push in, okay? You have to be willing to take their entire body weight. If she goes into a contraction, just drop your knees. You gotta hold them up, because if they're in the middle of all of a sudden you get a contraction, you need a place where you're comfortable enough to support them, let them go through a contraction. So, and then same thing as you lay down, you just slide up to the top of the sacrum and hold on to, you're just supporting one hand over the top of the other.
What's the difference? Why would you do the standing instead of laying? Just if it's more comfortable for me to stand?
Or if you're out and about and you're walking the halls and you're sore and you go, would you hold on to my sacrum for a minute? You can stop, you guys can lean against a wall, they can lean against you, sit and hold on to the pressure, and it just relieves the pressure as you're lowering. So the answer is it depends. Again, go back to the whole thing, whatever you're comfortable with. Okay. And you can even do the same thing if you had one of the balls. Even if you were laying over a birthing ball, or you're on your hands and knees, laid on a ball, or even if you were on your hands and knees laid in this direction, you can do the exact same thing, same pressure, same direction. Yeah, exactly. As long as the sacrum is accessible.